So the number one question is 1A. Lack of awareness among people, like why RCT and why with bioceramic sealers, direct pulp capping, GIC versus composites, early to decay, different caps, tobacco, brushing technique, plaque. The point is, if you are running your practice, if you don't know your patients, if you don't know your clients, if you don't know the biotype of your patients, you have no right to blame any patient that it is lack of awareness. Who is supposed to spread the lack of awareness? Knowledgeable professionals like us. So if we believe that it is the responsibility of someone else, then we are actually, you can say, shirking away from our responsibility. That is point number one. So the more you create the awareness, the more you will create the need. And the more you create the need, it will reflect in your OPD and it will reflect in your bank account, because it will lead to more of conversions and more of patients. Now, why RCT and why RCT with a bioceramic sealer? Now, see, the patient comes for pain. We try to tell him that it needs a root canal. Yes, your diagnosis might be absolutely correct. I'm not challenging that. So, but to use a eugenol-based, non-eugenol-based resin, bioceramic sealer, it is absolutely your prerogative, your comfort level. See, I'm not here to criticize any materials. I just want you to put across a point that RCT is used to run even with a eugenol sealer as well. Now, that does not mean that you shift to eugenol sealers. That itself means that if you are using a bioceramic sealer or a resin sealer or anyone which is higher end priced, then you need to make the patient aware of the benefits, pros, cons, or whatever of using other and these between that. If you don't create the awareness about these things, why do you expect the patients to know everything? They'll probably know everything about the root canal after, you can say, Googling about the same. But a root canal with a bioceram sealer is a complicating of the things or complicating of the matters which you need to spread awareness. I'm not saying you don't do it. I'm saying you do it, but create the awareness first. At the end of the day, the patient needs relief from pain. Whether it is from a eugenol-based sealer or a bioceram-based sealer, it does not make any difference to him. You know it that eugenol may cause a lot of post-operative pain. So that is the reason you are telling the patient to undergo a root canal with this, and accordingly higher charges. So create the need first, make them aware first, then only. Now, direct pulp capping or GIC versus composites, it's easier to imagine. Direct pulp capping, you can always make the patient understand that we are taking a chance to save your tooth from a root canal. There are pitfalls, there are side effects that maybe it becomes a root canal soon, or a proper root canal may need to be done, or maybe a pulpectomy need to be done. But we are giving the tooth a fair and square chance for a direct pulp capping or an indirect pulp capping. So make sure. GIC versus composites, it's a no-brainer. The wear part, the aesthetics part, the usage part, the comfort part, the only benefit of GIC is that it is an insulating material if used as a sandwich technique. It is kind to the pulp if you are placing it maybe subgingival margin. So those are the two advantages primarily. Of course, there are many more, but I'm just broadly listing them compared to composites. But if composites are to be done and GIC to be done, you have a choice. It is a no-brainer. You will always have a composite as a first choice. So you have to make them aware why this, why not that. If you create awareness, they'll automatically be learning it. Then early tooth decay, different caps. Again, people believe in their own notions. They believe that sometimes more caps are good, less caps are good. They keep only one kind of cap, keep only two kind of cap. A personal choice. We also give options in clinics, in our clinic. So it is your choice how you want to do it. Because the more options you give, the more you have to detail to the patient. The problem in India is most people don't like to spend time with the patient. They want to just start with the treatment there and then. And that is one of the biggest mistakes, I would say. Not doing the first consultation properly, not spending the time with the patient. Then even if you create the need, doing sales by default, not doing sales by scripting. How many of us actually practice the sales scripts? How many of us actually practice how to talk to the patient, how to handle their objections? How many of us actually do role reversal for a medium to big ticket case? Very, very few. So if you are doing things by chance, by default, and not by script or not by design, why do we expect conversions also in that sense? So lack of awareness is related directly to your conversions, directly related to your patients picking up the lower price ticket plan, a lower priced, you can say, treatment plan in that sense. I hope you get the answer. So 1B is poor people and some affordable patient also tell, just give medicine, do not want treatment. Because maybe they have not got the desired trust factor on you. Now, this can have multiple reasons. Of course, it starts with the look of your clinic. And I'm not saying have flashy interiors, have very vintage kind of a very, you can say very rich interiors, but it should be decent looking. It should be neat and clean. The corners should not be having dust. Your sofas should not be torn. Your blinds or curtains should not be, you can say, dirty. So those things in internal marketing make a lot of difference. And how your staff presents, what is their first encounter with your staff, that makes a difference. Most of the clinics, the patients have their first encounter with the staff only and not with the doctor. And if the staff has not behaved well or not behaved in a courteous manner or not behaved in a cooperative manner, I would say the patients would feel that probably this is not the place. Then the final nail in the coffin is when we try to rush the treatment, when we literally try to hard sell the things, when we literally try to push things down their throat, when we try to shove it down their throat and we try to make them believe that if they don't get it done, this would be the end of the world. That is where we create a mistake. So if you are not creating the need enough, if your clinic is not looking good enough, if you are not appearing convincing to the patient that yes, this doctor knows the trade well, he knows his job well, patients can literally make out with, we can say, a couple of conversations with you that how confident you are. If you are not confident, which is absolutely fine, some people are introvert, they don't have that kind of you can say conversation levels. Remember, it is a learnable skill. You can always alter it, you can always change it, you can always, you can say, improve it. So don't worry about those parts. Now 1C is lack of number of patient of footfall, lack of number or patient footfall. So this is the primary problem with majority of the dental clinics. If I have to pinpoint two queries, you can say biggest queries in any clinic, it would be lack of patient footfall, patient bargaining. That's it. Of course, there are multiple, but if I have to pinpoint any two queries, which are the, you can say, the large ones or the most asked ones, these two are the ones. So the lack of patient footfall has a primary reason, primary setting, or a primary answer in marketing. Now, when I say marketing, people understand advertising and promotion. So that is where your, you can say, pitfall lies in understanding that marketing is not at all only advertising or promotion. If it was, what do the patients gain out of it? There is ample amount of people present out there, but the one who adds value makes a difference. Take this session for an example. Am I doing it for money? Am I doing it for any returns? The answer is no. I'm using it for my visibility. I'm using it for my marketing. I'm using it for establishing my credibility, that I know the things. I know a lot of things. If not all, I know a lot of things, which I'm trying to share freely and openly with all the colleagues. I never make a distinction between the fact when I'm taking these kind of sessions, that whether these sessions are paid or non-paid. So I don't make a difference in that. Of course, my paid workshops are entirely different. That is a different topic for any other day altogether. But what I mean to say is that if you are lacking numbers or lacking footfall, then you need to understand, if you are not visible to your target audience, why would you get results? Why would you expect results? And if you are not getting or expecting results, the problem lies primarily with you only and not with them. Many times we sit in our four walls of the clinic and expect the patients to walk in And we believe that we have the best of the materials, best of the skills, best of the teams, but we still don't have patients because you are not known or visible to your target audience or to your patients or to your prospective patients. This is the biggest flaw. This is the biggest fault. Many a times patients say this thing after a good treatment from you. They are very happy. They are very satisfied. And they say it, doctor, where were you all these years? I would have gotten my treatment done from you long time back. I wouldn't have roamed around here and there. मैं कहीं और नहीं जाता. And suddenly then you realize, look at the heavens and say, thank you, Lord Almighty. Somebody is there to care. Somebody is there who appreciates my talent. But the problem is that the patient is maybe in a right way. He is being sarcastic. He's saying, of course, he means to say, not saying it. He means to say, why the hell were you not visible to me all these years? In marketing, the simple one-line answer is, if you are capable and master of your craft, it is your responsibility to be visible to your target audience. Period. End of debate. If you feel being doctors, you can't market, you can't advertise, you can't promote, you can't add value, you need to understand that you are in a wrong place. Now, people ask me how to do marketing. Should I do paid marketing first? Should I do inorganic first or organic first? The thing is, even if you do a paid marketing, somebody will seek validation from you. They'll search out who is Dr. Bhavdeep Ahuja. They'll Google Dr. Bhavdeep Ahuja. If they find me on a couple of places, my website, probably my social media, they'll come to know, okay, this guy is making videos also. This guy is writing blogs also. This guy is doing podcasts also. This guy is doing some infographic and posters and patient awareness also. Okay, I feel I can trust him. Of course, he'll check out Google reviews as well. So this is the validation concern to your paid ad. When you do a paid ad and they don't find you organically, I don't find him anywhere, he may not be a scam. And then people have a failure of paid marketing because the opinion could not be validated. Post-COVID is a very, very funny world we are living in. People seek redemption, people seek validation, people are looking out for those things where they can, you can say, challenge their mindset to check out whether they don't get trapped in the wrong place or not. They should be in the correct place. That is their mean. पैसे तो सबने लेने हैं, डेंटिस्ट ने, I mean, वहां पे दें जहां पे काम अच्छा हो, जहां पे ट्रीट अच्छा किया जाए. That is the mindset people have mostly. Means we have to pay everywhere. Dentistry is costly, but we should pay wherever it is deserving.